Good afternoon. My name is Kyla Albright. I'm the Director of Academics and Vocational Services for BasePoint. Thank you for joining me this evening. Tonight, we're going to talk about teens and their experience with school avoidance and anxiety, and hopefully some strategies that you can take away today and utilize with your students at home. As an introduction, we're going to talk about understanding school avoidance and what the actual definition of it is in relation to anxiety, and then maybe some contributing factors as well. For the learning piece, we're going to talk about some evidence-based approaches that we utilize in the clinic and some strategies that you can use at home as well. And then for supporting these students, we provide coping skills and self-coaching, which we will share in this presentation. And then ultimately, the ultimate goal is collaboration with our teens and the school counselors, teachers, and providers. We'll start with this quote that I felt like was very fitting for this presentation. Avoidance is the lifeblood of anxiety, so school refusal is the ultimate example of avoidant coping. And that's what we see both in the school setting and in the clinic. And I'm sure that if you have a student who's experiencing some anxiety or school avoidance, you can agree that a lot of the behaviors you see are a part of their coping mechanism. And so, how can we build some positive skills to help them be successful? What is school avoidance? It's when a child or a teen refuses to attend school or has difficulty remaining in school the entire day. So, some important distinctions to make is that it's a pattern of behavior, not just one or two isolated events. It's also not a clinical diagnosis. It is often connected to an anxiety disorder or even academic learning challenges, could even be some past stressful or traumatic life events. And then it is different from truancy. And so typically they might see school avoidance as being a sign of laziness or defiance when really we're trying to dig a little bit deeper to see what are the underlying causes or distresses that are preventing the student from wanting to attend school. Some things that as parents we can look out for. Emotionally, we're looking for maybe a child who's very worrisome, maybe they're fearful, they have a lot of irritability. With behavior, we could see the, of course, the frequent absences, but then just the resistance to leave home or even the detachment from you as mom and dad. And then it could also be frequent visits to the nurse. And that's the connection with the physical portion. So that's when we see unexplained headaches, a lot of stomach aches, or maybe even the nausea, which is especially in the mornings. And then with cognitive, it's the negative self talk. Maybe there's just a lot of doom or gloom, everything's worst case scenario, and they have a lot of shame about their performance. And then socially, maybe they're becoming withdrawn from their peers or isolating from their family unit. This is a great visual to use whenever you're talking with your kiddos, but also just for parents as us to have a visual reminder of what that avoidance cycle could look like. So we see that over here on the left-hand side, we have exposure. That's when the anxiety is rapidly increasing as it's happening, and then they hit the panic peak. That's typically going to be where you might see some of the increased behaviors. So whether it's school avoidance, it could be an actual panic attack. But then ultimately, we want them to get to the right-hand side of this curve, which is where the anxiety will diminish. And of course, that takes time. We're building skills, we're adding to their toolbox to help them be successful. But when we stay on the left-hand side of this bell curve, where we're providing the temporary relief because the kiddo stays home from school, then that habituation is not occurring. And so then the next time that that situation arises, anxiety starts to build again. We hit the panic peak, and then here we are with the avoidance and the behavior. So as you can see, it's very easy for our kids to get stuck in this left-hand side where they're in that anxiety cycle, but really we want to build them to this side where they start to have those skills that make them feel successful so that they can push through and attend school or the events that they're worried about. The four functions of school refusal are really interesting here. And so it helps us identify that school refusal is not just one component, it can be multiple things. The top two are related more to school, the bottom two are related more to home. So at the top, you see avoiding distress at school. This could be they are worried about overwhelming environments. Maybe it's a crowded hallway or a crowded, loud gym. Maybe it's the cafeteria. They could also have sensory overload or even academic learning struggles. Avoiding social pressure in regard to test anxiety, giving presentations in front of their peers in the classroom, or maybe it's performing in an extracurricular activity, whether it be in the gym or on the field. Staying close to a parent or caregiver with separation anxiety, maybe some traumatic family stress, or the fear for their own caregiver's well-being. Maybe there was a recent diagnosis or medical scare, and so that's causing the student to want to stay home and be close to that parent or caregiver. We also see another function as being seeking comfort, where they're actually seeking a reward at home by staying there. So it could be reinforcement from the rest, which is extra sleep. Maybe they're getting their phone or screen time when they're staying home from school. Maybe a pet as a companion is helpful as a reward, and that's the function of them staying home. Or it could even be extra attention from us as mom and dad because these siblings are at school, but then they're here at home, and so they're getting that one-on-one attention. Some contributing factors beyond those four functions, we know that mental health challenges play a huge role, again, with the anxiety disorders, but can also be depression and maybe even emetophobia, which is that fear of vomiting. We see learning differences and cognitive load being a situation, whether it's dyscalculia, dysgraphia, maybe some processing speeds there, but they have the academic shame and frustration because of some previous struggles. And then it could also be the situational and environmental triggers, or maybe there's some bullying amongst peers, some past trauma, maybe some recent grief in the family or in the school setting, and major life transitions. So again, just focusing on that it's not just one function or one factor causing the school avoidance and anxiety. A lot of times it's a couple of them here and there that we're piecing together to figure out what is that true underlying cause. We know that with our kiddos, sense of control is a huge aspect of just human beings in general, but they're going to tend to avoid situations that feel uncomfortable. And so school can feel overwhelming. And so a lot of the day is out of their control, which can then heighten that anxiety. So how can we, as parents and as school staff, give them identify parts of their day that they can control to give them that sense of urgency that helps reduce the anxiety? So just as a school counselor, I would always talk to my kiddos about the circle of control, and I do that with my own children at home too. And so what are some things in the middle circle that we can control? That's what we're going to focus on. And then we can list things on the outside that we can't control, but we know they're there and we can be cognizant of it. But we also need to know what we can control, and that's what we're going to focus on. So if you look at these quotes here at the bottom from the American Academy of Pediatrics, it's really interesting to look at that first one, which says loss of control and ineffective coping can then lead to a range of negative health behaviors. So that's what we're seeing. Some of the negative behaviors at school or at home could even be some negative effects on their health, whether it be the physical symptoms or the mental aspect, but it's because of that loss of control and not having the skills to cope. And then on the more positive end, you see the bottom quote there that says further, when teens do feel a sense of control, then they can be focused, goal-oriented, and less stressed, which ultimately as a parent and a school counselor, that is our ultimate goal. Validation is a big key factor here that we can do for our kids. It means that we're acknowledging how the teen feels, but we're not going to enable the avoidance. So we can still set expectations and boundaries and understand their feelings and hear them out while also holding them accountable. Some conversation tips here at the bottom are some great one-liners when you're listening to your kiddo at home. Maybe it's at the dinner table or in the car ride, but just hearing them out. First one here says, well, I can see why that situation would feel overwhelming. Or test days can bring a lot of pressure and it can make your body feel that way. Maybe that's why you're having the headaches or you're having the stomach aches. And then math, it can feel draining. I had that same situation. It doesn't click right away. I hear that. Again, just validating how they're feeling, trying to be real with them that we understand, but we're still holding the expectations and the boundaries. Using curiosity to explore is also a great one. Just asking them some open-ended questions like, what part of class today was most challenging for you? Or what was your easiest part versus your hardest part today? And is there something that could make this more manageable for you? As a family, what can we do to help support you? In the clinic, we typically use CBT or cognitive based therapy for these types of interventions. School avoidance is typically going to be best addressed with the multi-systemic approach. So we want the family involved, we want the school staff involved, we're inviting the clinicians into the conversation, as well as the teen having that sense of control. And that's where we're going to see the gold standard. We're going to see these students feel successful. And then parents and caregivers, we obviously play a crucial role in supporting these strategies at home, because ultimately, if we're not practicing them at home, it's going to be really hard for them to transition to school and utilize those same skills there. With CBT, that is going to help students recognize the distinction between thoughts and feelings and behaviors and how they're connected. And then also the therapists are providing coping skills and allowing them to practice those. So whether it's problem solving or cognitive restructuring or even some relaxation techniques that they can utilize. Exposure therapy is more of the graded exposure to those fearful situations. So the goal is to reduce the avoidance and increase the tolerance of discomfort. And then avoiding those short term reliefs, but reinforcing long term anxiety. So we know that sometimes exposure can be hard, but that's how we're going to get over that hump and make that child feel successful. Students learn that there are feared situations, whether it's test anxiety or a crowded hallway. Maybe there's certain classrooms that are not as interesting or exciting to be in. And so that's where the anxiety can increase. But if we build familiarity, we build comfort by exposing them to those situations, it starts to feel less threatening. Excuse me. It will also improve their attendance, which will then obviously lead to better school participation and in the end increased grades, because they're there for the assignments, they're there for the teaching lessons, and so they're able to actually interact and get what they need academically. With the coping skills, we're helping them manage distress and regulate emotions, which every student needs. It's really hard whenever your emotions are taking control to regulate them if you haven't practiced them or you don't have a skill set. We want our kiddos to feel successful and build confidence. And then we also want them to have peer connections. A lot of the students in schools that are not connected to a group or to some type of peer activity, that's the ones who feel more isolated and a lot of times might have heightened anxiety. So if they are at school and you can help them strengthen those peer connections, that's ultimately going to be the best interest of the kiddo. I thought this quote was really good for our teens because they can visualize this, they understand it. If we can effectively decrease avoidance, the anxiety will diminish naturally on its own. The same way that if you get in cool water, your goosebumps will go away naturally. And so this is really cool because the student can think about jumping in a cold swimming pool or getting into an ice bath. These type of things will cause you to have goosebumps, but then they eventually do go away and the cold feeling starts to subside. Same thing with avoidance. If we actually go into school where it feels uncomfortable, after so many minutes or after so many classes, it's going to start to feel normal and natural again. And so utilizing that quote as just a familiar piece to help kiddos kind of visualize or experience what could help benefit them. These techniques are typically what you can utilize for CBT or exposure therapy, but it's really easy techniques that we can even practice and try at home or in the school setting. So for gradual exposure, it's just maybe taking a few minutes in a classroom that's hard, and then going back to the counselor's office to debrief, and then gradually increase over time how long they stay in that classroom until our ultimate goal is met or they stay in class for the entire period. The next one is attending lunch in a less crowded area first. As a school counselor, sometimes I had students with super high anxiety that couldn't handle sitting in the cafeteria for lunch. And so we would set them in the library or maybe a small group classroom so that they could have lunch in a less crowded area. And then as they build the confidence being at school around other peers and at lunchtime, then we move them to the busier cafeteria with a trusted peer or even a trusted adult. Walking through the hallways during non-peak hours and then during transitions. so that it's not as crowded and they feel more confident, they know where to go. Sometimes that can help reduce that anxiety. The coping skills that are utilized in the clinic that are very easy to practice at home and also in the classroom: grounding techniques, just using your five senses. This is going to activate that prefrontal cortex of the brain, their logical thinking, so that their emotional brain has to shut down for a minute. So I asked the kids, can you name five things that you see? What about four things that you can feel? Three things that you can hear? Two things you would like to smell? And one thing that sounds good to taste. And these could be written on a sticky note or even in a journal. But again, just activating that logical part of the brain so the emotional brain has to turn off for a moment. Anchor object is something they can bring from home. Maybe it's a keychain or a bracelet, something that has a specific texture or temperature or even a weighted item. That can be helpful. Routine and predictability are a huge piece in regard to the control aspect. And so, what kind of consistent morning routine can we build for our family and our students to help them feel better about going to school and reduce that anxiety? Sometimes visual schedules are helpful, or even a checklist for the activities in that day so that they can take to school and put in their binder or in their backpack, and they can follow it and help them feel more confident. We also send students to school with just a small little journal. This can be something where they write down throughout the days things that are good, things that are bad, maybe successes and challenges. And then later on in the evening, you can discuss that journal and what was in there. And that's just a way of them learning to self-coach and reflect on the day. And then as far as environmental adjustments, you always have your school counseling staff available that can be utilized as a break or a brief pause throughout the day if they need to check in. And then also seating choice within the classroom could be an accommodation built in to the student's plan to help them feel successful. As parents, these are some great anxious moment techniques to use at home. So box breathing, where it's also 4, 4, 4, 4. So they're inhaling for 4, holding their breath for 4, and then exhaling for 4. They can also do this on a journal where they're drawing the square as they're doing the breathing technique, but very discreet, easy to use, and it's a body-based fast relief for anxiety. Cold water on their face, that's going to trigger that nervous system reset. So again, the emotional brain has to take a moment off so that they can reset, and that cold water will do the trick. Sour candy works for a lot of kiddos, so sending them to school with that or trying it at home, that could be a grounding technique that helps interrupt those anxious thoughts. Progressive muscle relaxation. This is where typically you can tell your kiddo to start from their toes and then work all the way up their body where they're tensing up each muscle group and then releasing that tension, and that will help with the anxiety. And then the grounding technique that we discussed on the previous slide, same one there, the 5, 4, 3, 2, 1. Some students prefer the thought-based method, and so that's going to build over time. Reframing. So if your kiddo comes home and they're like, well, math is really hard. Okay, well, yes, math is hard, but you can do it. So let's rephrase that. And so having them reframe that sentence on their own and helping them build that skill over time. Name it to tame it. If we can name the feeling, it's easier to tame. So mom, dad, I feel anxious. Okay, that helps them create that distance from the feeling. Self-talk, reminding them that, hey, you've handled hard things before. This is something you can handle as well. And again, journaling through that self-talk is very beneficial. And then problem solving, back to what can I control? And we're going to take it one step at a time. As a parent, the best way to do this is practicing it with your teen, not just teaching them. So in the moment, even as an adult, when we have those anxious moments, showing them and modeling those strategies, that's going to help normalize these techniques so that they're able to manage their big emotions at school when we're not there with them. For our kiddos at home, the first tip would be to help them understand that anxiety is a term that we use and it's thrown around a lot, especially with their peers, I'm sure. But how can we determine the difference between something that's uncomfortable versus something that's unsafe? right? And so helping them understand that it's okay to feel uncomfortable sometimes. It's okay for things to be hard, but that doesn't necessarily mean that it's unsafe. And so we can normalize that anxiety is a natural human response. It's not a permanent barrier. With the validation, we're going to acknowledge those feelings. We're going to remove that expectation that's too high and just keep having them understand that it's okay for you to feel this way, but we are still going to have the barriers that we jump over those hurdles. We're supporting them through the moment rather than helping them avoid it. So if it's a hard morning and they don't want to get out of bed, we're helping them through that moment, helping them to the car and to school instead of just allowing them to stay in bed and stay home for the day, and then supporting their attendance over time or their independence over time, helping them become their own coach, because ultimately we want them to be successful adults. We want them to get a job and be able to manage anxiety when it comes about. And so we're going to celebrate those small wins. Like, hey, you did something hard today. What helped you? Did you utilize that journal, writing down successes or challenges? Did you utilize the 5, 4, 3, 2, 1 strategy? How did it work out for you? And these are great ways over time to help build that independence. In partnering with school, we see that that's going to be our best plan of action. And so providing context to the school staff, whether it's the school counselor or assistant principal, whoever you've been working with, to help them understand why your teen is struggling. Mom and dad, parents, guardians, you are their best advocate in regard to education and how can we help them be successful. So in order to reduce mislabeling, we're going to help lead to adding more support for our kiddos by letting the school know what is happening for these absences. Why does it keep happening? Is it physical symptoms? Is it some overwhelmingness regarding a specific teacher or specific class? But don't just keep quiet about it. Ask for help, ask for strategies. Staying aligned on expectations, the school and us as parents, we're working toward the same goal. We're going to stay consistent. We want our kiddos to be in school, but it can be a gradual expectation if needed. And then also keeping the focus on progress. So we're going to share the small wins. We might only attend partial days, but it's better than nothing. Getting into the building, that's a win if it's someone who's had a really hard time getting into the car and actually making it to school. So again, progress over perfection, and then having that school support system to help adjust when needed. Some things to think about when needing to seek additional care. It could be that these behavioral issues have just continued to increase over time. Maybe you've seen some intense mood swings from your kiddo at home. They're engaging in high risk behaviors. If your student has been in an inpatient facility and now they're stepping down, discharging from a hospital could be a great time to seek additional support. If they are struggling with anxiety, depression, or trauma, and then when our typical outpatient therapy just isn't working, maybe your kiddo's going for treatment weekly or biweekly, but you're not seeing the progress that you had hoped for. And then also if they're experiencing any kind of suicidal thoughts or threatening to harm themselves, and then especially too with the substance use. So these are times that we would really identify or flag it as additional support is needed. In mental health, we have this triangle that's really easy to utilize and see as levels of care. BasePoint specifically falls in the middle section, excuse me, for PHP and IOP. PHP is that partial hospitalization. That's sometimes referred to as day treatment. And so they're with us at BasePoint Monday through Friday from 9 to 3:30, and they get group time in the morning and then education time in the afternoon. And then intensive outpatient is just a step down from that. Again, it's still day treatment. They're with us during the day, but they have the option to go back to campus in the afternoons or at that step down level. And then counseling and psychiatry services, that's going to be the bottom level of care. That's that weekly or biweekly visit. And then going up to the top is going to be your inpatient and your residential, where they're needing that higher level of care. And so as a parent, if you're struggling to know where does your student fall in this pyramid, you can seek clarity with a mental health assessment. And we provide those complimentary at BasePoint free of charge. And so those are available to you if you feel like you would like to make a call to us, and we can be there to support. Our Patient Access Center is open from 7 a.m. to 7 p.m., 7 days a week, and 365 days a year, because we know that mental health does not sleep, even on weekends, even on holidays. So that top number there, 972-325-2633, that goes directly to our Patient Access Center. And within that time frame, 7 a.m. to 7 p.m., someone will answer your phone call and they will answer your questions in regard to mental health and if you would like to schedule that same day mental health assessment for your student. All right. And then this is the end of our presentation. So I really appreciate you guys being here tonight. Thank you so much for your time. Again, feel free to reach out to us if you need anything with that number there or scan that QR code, and we will all see you soon. Thank you so much, Frisco ISD, for having us and parents for joining. Have a great afternoon.